Hi, this is Dr. Simon Feng. We have all heard or seen the message that addiction is a disease. The campaign to call addiction a disease aims to decrease the stigma associated with addiction, stigma that discourages people from seeking treatment, and also stigma that fuels the mistreatment of those living with addiction. However, as an addiction doctor, I find that practically no one actually believes or understands this message. Not most patients and not even many physicians. In this video, I will explain why I believe the message has not been effective. If you ask doctors how they know that addiction is a disease, you get neurobiology, which is roughly the medical equivalent of rocket science. Accurate, but nobody really gets it. Yes, addiction involves dopamine and reward pathways in the brain. But neurobiological explanations do not connect with people. To illustrate this point, consider that depression is well known to involve the neurotransmitter serotonin. Yet, patients almost always attribute the depression to real-life problems rather than to some kind of serotonin imbalance. Now, we come to what I consider to be the biggest problem for the message that addiction is a disease. The American Society of Addiction Medicine clearly and carefully calls addiction a disease. However, heroin addiction and alcohol addiction are not the official diagnoses. The proper terms are opioid use disorder and alcohol use disorder, which are terms that come out of psychiatry. Addiction will always be linked to psychiatry, which means that even when addiction is accepted as a disease, it's usually thought of as a mental disorder or illness rather than a medical disease. Thinking of addiction as mental illness does not help us escape stigma. For the reasons outlined above, I believe that the message that addiction is a disease is not effective. In a separate video, I will make the argument that addiction should be thought of not as a mental disorder, but as a typical medical disease, because addiction behaves in exactly the same way as almost every other chronic medical disease. Thank you for watching.